Well, the CDC has announced its recommendation for an antibody to help protect all infants under 8 months and some older babies at increased risk of severe illnesses caused by RSV. Now, the viral infection targets newborns and can cause severe lower respiratory tract infection, also leading cause of hospitalization for infants under a year old in the United States. So what is this new antibody and what should parents be aware of as, of course, we are heading towards cold and flu season? Joining me now is Dr. Heather Staples from USC's School of Medicine. Thank you so much for stopping by this morning.
Thank you for having me.
Yeah, well, let's go ahead and talk about this antibody. So what should parents know about this now that the CDC has recommended it?
Sure. So we've always, well, not always, we've had an antibody on the market for quite a while that we've been using to protect premature infants. So this new antibody is in this very same class as a well-known and tested antibody that we've already been using, but this one is now available to all infants who are born even if they are not premature. So if you are born within the RSV season or if you're 8 months or younger at the start of RSV season, you'll be eligible for this new antibody.
How important is it to, kind of get these out now, especially as we're doing cold and flu season? I know the fall is kind of gearing up. So how important is it to kind of get this ball rolling?
It's very important because we see a lot of hospitalizations in young children secondary to RSV, and so it can cause quite a bit of complications, even in babies who are born at term. So having this available can be life-saving, if not protecting children from just long and complicated hospitalizations and other severe illnesses that sometimes can keep parents home from work for long periods of time, and even just cause a lot of heartache for families just watching their children being very sick.
I mean, that is definitely the biggest part, it takes a toll not only on the child, but it really does take a toll on the family.
Yes.
When you have been working, at the medical school, what have you been seeing with RSV? Is there an uptick, or what are we kind of seeing right now?
We are starting to see some RSV cases come through. I expect to see that slowly increase as we go into the fall.
So let's go ahead and talk about the fall. So I know fall season, cold and flu as well. So for parents who are watching maybe this morning, what are some home remedies, if you will, that maybe they can, take today to make sure that their kids are healthy, especially for the school season too?
Sure. So the biggest thing I'd recommend is preventative measures. That's the first thing that they can do. So flu vaccines, really good hand washing, making sure that you're staying home if you can when you're sick. But the things once you do get ill, is staying well hydrated. That's a really important part of recovery, resting when you can. And otherwise, just really taking care of yourself. If there's fever, treating the fever if it's making you or your child feel ill. And then seeking medical help if you feel like your child's not recovering well, or if you notice that they're having significant symptoms.
Now, are you all kind of gearing up for that? Are you gearing up for this uptick, not only for RSV, but for just kind of cold and flu season right now?
Yes, we definitely are. We're encouraging all of our patients to get their flu vaccines. We are starting to talk to our patients about when to seek medical care and making sure that they're prepared.
So what does this look like, for parents? Maybe they're new parents, bringing them right into the first day of school and dropping them off. And, of course, with kids going back to school, a lot of times they do get sick. So maybe what is your advice for that? Kind of always making sure they got the Kleenex and the wipes on hand?
Yes. So we talk about a lot of hand washing, hand sanitizer, having that available, and then encouraging parents to keep their kids home if they can when they're sick. And that protects not only them, but the other children in the classroom as well.
All right, Dr. Staples, thank you so much for stopping by this morning. We really appreciate it.